health and wellbeing film, and the second film in a series of 4 preparation for adulthood films.
So I think health services are one of the things to consider as your child moves into adulthood. We were really lucky to have the paediatricians and the school nurses at school, and that then changes as you move into adulthood, and healthcare for Joseph anyway, who luckily does not have very complex health needs, but healthcare becomes based with your GP. He has an annual health check, although it's not entirely annual. I don't know when his last one was, but it is something that I will continue to pursue, because I think that monitoring of what is normal for someone like Joseph is really important.
He's had annual health checks mostly, and 3 or 4 years ago now he was transferred from having a GP see him to the practice nurse. And we were worried about that because we thought that was a bit of a sort of a letdown. But in fact it's been good because he has a good relationship with the practice nurse.
2 years ago, Sam developed like a chest infection. I said to my husband, call the ambulance, call an ambulance. And they said the ambulance could be there half an hour to an hour. I said, there's no way, I'm not waiting. I drove my car to A&E. We went straight in, and as soon as they saw him, they took him straight in. And then I remember a conversation that I'd had the week previous with Sam's psychiatrist. He had told me about learning disability nurses, and that if Sam ever were to go to hospital because of his challenging behaviours and stuff like that, that I could call. And I found a number and I rang, and they were there within half an hour. And she came and she spoke to everyone there. You know, Sam has to have somebody with him at all times. If not one person, then 2, because Sam has challenging behaviours. You need the parents to stay here because you won't be able to handle him if he has a challenging episode. So he was in hospital a total of 3.5 weeks, and I was allowed to stay the whole time.
The staff at Kendall House have been amazing, attending the hospital appointments with him, supporting him through that, because I used to do all that, and I look back and I'm like, I don't know how I used to do that as well.
Less cake, more salad. So Sarah, I haven't had cake this week, I only had salad because I love salad. And I've been trying to have one day on fried chips and one day salad. Well, they're trying me to eat more healthy stuff than bad stuff, because if I eat unhealthy stuff, then it's bad for my health. But if I eat good stuff, then it makes me feel more healthy and fitter, Mommy said.
I'm glad that I've got a nice dentist that understands me. That's one side of the health system I respect. Another side of the health system, I'm glad I've got a learning disability nurse that respects me.
And therapy.
Oh, and obviously as well, I'm glad that I've got a therapist that also understands me. And very soon I'm going to find out whether I'll have a dietitian who's going to understand me. But overall, it's been good overall.